Today, June 24th, it's almost exactly a month ago that in this House, the misnamed One Big Beautiful Bill was passed in the dead of the night after hours and hours of debate, again, while the American people were asleep at home. And the rush of events that takes place every single day, it sometimes gets hard to remember exactly where that stands and what's going on. The bill is moving in the Senate, literally as I stand here in the well of the House. And in the light of day, over the last month or so, a lot of the rocks have been kicked over in H.R. 1 to sort of see what's in there, and a lot of pretty ugly things have slithered out. Included was a provision to auction off some of our precious public lands out west, basically robbing those treasured assets for future generations. A deregulated gun silencers, which have been on the National Firearms Act since the 1930s. Who benefits from that? I mean, I'm sure there's a lot of criminals that are rooting for them to be able to go out and buy tax-free gun silencers. It increases the national debt by $5 trillion, about $3.5 trillion in new debt with another $1.5 trillion in interest payments. Cuts taxes for American families above $500,000 a year income to the tune of over $1 trillion, with a pittance for middle class and working families. And it raises the debt ceiling by $5 trillion so the government can sell bonds to debt finance. Again, a bill that basically benefits the Elon Musk and Jeff Bezos of the world. But what is really at the heart of H.R. 1 that should concern every single American is a provision that includes the largest cut in health care spending in American history. Over $1 trillion of cuts in the bill as it left this floor on May 22nd. I have here a poster next to me that talks about what the real-life impact of that's going to be on hospitals all across the country. And it's not coming from me, as a member of the Minority Caucus. This comes from the Robert Wood Johnson Foundation, which has been around for 50 years and is a completely nonpartisan analyst in terms of healthcare spending and healthcare financing throughout the country. And what it did was break down state by state what the impact of this bill will be. And so for the state of Connecticut, where I'm from, it's actually about a $9 billion cut over the next 10 years. In terms of the Medicaid program, as well as eliminating the premium tax subsidies for people who get their health insurance through the Affordable Care Act. That's about 15 million Americans. And the hospitals in particular are going to take the biggest hit. As this headline says that in the Connecticut Press, it's about $4 billion over the next 10 years. And again, all of my colleagues that are here today, I would encourage them to look at this analysis, which shows state by state, sector by sector within healthcare spending, hospitals, physicians, prescription drugs, in terms of the impact that this bill will have. So there was a lot of hope that maybe in the Senate, this bill might be fixed and addressed, particularly because it hits rural hospitals so hard. And there are obviously so many Republicans in the Majority Caucus in the Senate that obviously are going to feel the pain if this provision goes through. Unfortunately, what we saw come out of the Senate Finance Committee is even worse in terms of what came through from the House. And again, don't take my word for it. Listen to the Catholic Hospital Association, who issued a statement just a few days ago after this provision came out that, again, they had warned them before the devastating impact it would have, particularly on safety net hospitals, which Catholics are definitely part of all across the country. Again, fell on deaf ears. Children's hospitals. Children's hospitals rely on Medicaid to a greater proportion than other hospitals because they don't have elderly patients. Obviously, they're children's hospitals, and Medicare pays for a lot of those patients. Children's hospitals have no place to cost shift, so their uncompensated care with this devastating Medicaid cut that's going to hit every state in terms of its federal matching funds is going to land on the most vulnerable in our society. And the people who are delivering the care, they're not partisans. They're not approaching Congress as Democrats or Republicans. They're there as people who are doing their job day in and day out. I visited one of those hospitals last week, Lawrence Memorial Hospital in New London, Connecticut, who over 40% of their patient census is on Medicaid. Again, it's in the heart of New London, a wonderful historic community. But again, it has a high Medicaid population. We have to stop this insane attack on health care that affects every single American. We've got to block H.R. 1. We've got to go back and do a better job for the American people. I yield back the balance of my time.